Hello everyone. I know most of you and most of you know me. And today I'm here to do a presentation, and it's for Jacksonville State University. It's for the MSN Population Health Program. My preceptor is actually Jessica Couture, the director here for 4 East at Southeast Health. And this is for our spring 2021 semester. And my class is nursing 552, and it's for my practicum class. My topic of conversation is COVID-19, and the title of my presentation is COVID-19 Safety Guidelines and Practices. We'll start first with my practicum objectives. First is to develop an oral presentation with PowerPoint utilizing Gagne's 9 events of instruction, including student learning outcomes and methods of assessment and evaluation. Next is to incorporate icebreaker activities, case studies, current news events, current news to attain my students' attention swiftly. Identify barriers and challenges during the practicum learning experience. Utilize a learning management system to allow students to assess needed materials outside of course meeting times. Recognize legal, ethical, and professional responsibilities as a nurse educator. Utilize a variety of assessment methods and evaluation of student learning. Employ teaching principles, educational theories, and evidence-based practice learned within the nursing program in the classroom setting as a nurse educator. Use self-reflection as a strategy for professional growth and development as a nurse educator. After this presentation, learners or students will be able to demonstrate appropriate application of PPE, which is just basically an abbreviation for personal protective equipment, and most of you guys know that. Understand proper guidelines and practices to decrease contracting COVID-19. Demonstrate appropriate application of masks and face coverings, and understand what causes COVID-19 and symptoms that may appear. First, let's talk about the death toll. A lot of us know people that have passed or at least been infected with COVID-19. And a lot of us know people that have actually succumbed to the virus and that have passed away. The CDC, which is the Center for Disease Control and Prevention, is reporting, and these are only the people that are infected, like the infection cases, at least 29 million cases added with another 40,336. And the reason that number kind of, if you go to the CDC website, you'll see one number and then you'll see the plus sign that says plus, because the numbers are changing daily. And they'll have so much one day, and then by the next day they've added another so many hundred or whatever. So you'll see one number and then you'll see the plus number with that many more added. So it's 29 million cases of people infected. The last time I checked, when I was doing this presentation, added with another 40,336. And those are just the people that are infected or the infection cases. Now move on to the deaths. We have 525,000 deaths, and these are actually individuals that have succumbed to the virus, added with another 682. And that's just an astronomical number to me on both cases, the infection and also the deaths. And COVID-19 has really been hard on not only families and people that have been infected and people that have died, but also on the medical professionals. We've taken a real hit, and it's just been tough. The CDC, which is the Center for Disease Control and Prevention, also reports that as of this year, January 1st of this year, 2021, the United States surpasses 20 million as deaths continue to mount. And I think now around this time frame, the numbers are starting to get better, and a lot of that has to do with, I think, people getting the vaccine and people just trying to do better as far as like social distancing and wearing the mask. But January of 2021, CDC reports that the United States has surpassed 20 million deaths. Let's talk about what is COVID-19. What is COVID-19 exactly? Well, I've made an outline, and we're going to go through pretty much all of these little topics. What is COVID-19? What causes COVID-19? How does it spread? Symptoms that may occur if infected, and proper guidelines and practices to help prevention. Also, we'll talk about appropriate application of masks and face coverings, hand washing and the use of hand sanitizer, and the appropriate application of PPE, personal protective equipment. What is COVID-19? Until here recently, we really didn't know anything about this. This is all new to us. This is all new to the world, basically. COVID-19 is a coronavirus. COVID-19 is the coronavirus disease. It's an infectious disease caused by a newly discovered coronavirus. And I believe we really started hearing about this maybe January of 2019, I think, when I first kind of like started hearing a lot of stuff in the news about it. And I think a lot of us were, not really worried about it, kind of skeptical. Oh, it's just, it's this and that. And the numbers start to rise, and we started to see a lot of other things in the news. And so a lot of us, became very leery. But then there was still a lot of people that were just like, oh, it's nothing. But it actually was something, and it turned out to be a lot. And it's been very hard on everyone, I believe. COVID-19 is caused by a coronavirus called SARS-CoV-2. And older adults and people who have severe underlying medical conditions like heart disease or lung disease or diabetes, or someone that is immunocompromised, someone that maybe has had a lung transplant or heart transplant or kidney transplant, and they're taking drugs to prevent their body from rejecting the organ, and then someone that also maybe is battling HIV or the AIDS virus. Those people are at a higher risk for developing more serious complications and even death from the COVID-19 illness. How does COVID spread? How does COVID-19 spread? It's thought to spread mainly through close contact from person to person, including between people who are physically near each other within 6 feet. So that's why a lot of the guidelines that are placed by CDC says that that's where the social distancing thing came from. We need to do social distancing, the mask, and stay 6 feet apart, because scientists and through study have found that it's greatly spread mainly through close contact. Symptoms that may occur if infected. People with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe symptoms. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19. And, if you have these symptoms, it's best not, some people wait and say, oh, I've tried this at home for a week. But if you have any of these symptoms, it's best to seek medical help. And let's start with a lot of them. Some people have all of these symptoms, and some people don't. But if you have a wide variety of these symptoms, then you do need to seek medical help. Fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, loss of appetite, sore throat, congestion or runny nose, nausea or vomiting, and even diarrhea. These are like core symptoms. So if you're having any of these symptoms, then you need to seek medical help. Yes, Oh, well, that is a good question. What if you don't have fever, but you have some of the other symptoms? So if you don't have, and some people don't have fever. So if you don't have fever, but you have maybe the difficulty breathing or the muscle aches and the headache, it's you still know there's something going on with your body that was not going on before. Even if you don't have I know the big thing is having a fever, but just because you don't have a fever doesn't mean you can't be infected. So if you have any of these other symptoms without the fever, I still suggest go and get yourself tested and seek medical help. I think it's important to do self-care. You know, when you talk about the fever and stuff, it's important to do self-care. Like, you know your body and you know if something's not right. So if you start feeling any kind of way, just go see your primary care physician. 3 factors to help make safer choices. Like this, we're still on the proper guidelines, practices to prevent contraction. 3 key factors to help make things safer: location, proximity, and time. As far as location goes, it's said that being outside is much safer than being inside. So like a close spaces inside is not as good as it being like in a wide open space like outside. So proximity, you need to be as far out as possible, not close together, at least 6 feet. And then time, cut your time down. If you're out and about, I don't know, just anywhere, grocery store, you need to go buy some other things at a different store, something like that, then cut your time down. Make your time short. Don't be in those places very long. That helps also. And if you have someone in a facility such as a long-term care facility, a nursing home, or someone in the hospital, make it a priority to do what you can, because there's so many guidelines that you can't come in, you can't do this, you can't do that. But now they have it where you can do video chat to your family, or you can call frequently, or you can set up a password and speak to the nurse about what's going on with them, things like that. Make it a priority to do that, because people that are sick with COVID and they're already isolated, and you feel, they just already feel so isolated. I believe that if they feel like people just really don't care, they don't really hear from the family a lot, that hinders care, that hinders them getting better, because then they become kind of depressed, and they just become kind of depressed. So just make sure you're checking on your family and do what you need to do. If they're in a nursing home or a long-term care facility, I think a lot of the guidelines are now you have to make an appointment to see them, and they have to know it's like a time frame so far ahead. And then if you can't come to the appointment, you're supposed to call ahead and let them know. And then also when you're on your way to that appointment, you call and let them know, I'm on my way to my appointment. Once you get there, I think you have to stay at least 6 feet away from your family member. They have like some type of barrier, but you are able to still see them and talk to them. And then you have to, of course, wear your mask and different things like that. Some of the guidelines may have changed because the numbers are getting better. But at one point in time, this was the guidelines, I know for sure, because I have a friend that goes to visit her aunt pretty frequently in the nursing home. And if another thing, we're still on the prevent contraction thing. If you're shopping for groceries, there's a few things that can help. First of all, take your mask and your hand sanitizer with you. Like, have your mask and hand sanitizer from home with you. Like some grocery stores, I know Publix, that when you get there, they're passing out either the wipes or they have the hand sanitizer at the front. But sometimes, you get there and they may not have it. So just have your own, and have your own mask. So, nothing stops you from doing your hands and having your face covering. And another thing, once you're inside the grocery store or the store, keep your distance. Like, stay don't be right up on the next shopper. Keep your distance and be courteous. Keep your distance and be courteous. And then there's the time thing. We said distance or proximity, and then time. And then there's time. Be in there as short a time as you can. So go ahead and make a grocery list before even getting there. Have your list ready so you can just get your items and go. And you're only in there a short period of time. Another thing is I hear people say sometimes, well, I had a doctor's appointment, but I didn't go because, with this COVID thing, I just decided I'm not going to go. Do not put off your medical appointments due to COVID. Once again, we said self-care is something that we're going to do to help and prevent from contracting it. So if you already have an illness or a chronic illness or something like that, then you need to go to your appointments. Go ahead and make an appointment. Don't try to go as a walk-in. Have your appointment already made in advance. Prepare like maybe the night before. Have your hand sanitizer, your mask, of course, things like that ready. And once you get there that day to the office, have your mask on. Have your hand sanitizer in your purse. You see other patients in there, make sure you're courteous and you stay not too far up on them, 6 feet apart, sit far apart, and follow what your primary care physician tells you to do. Be current and be up to date with your medications and be compliant with your medications, because self-care means a lot to also help prevent contracting COVID-19. Another thing we can talk about as far as preventing contraction. If you have someone that's sick in the home, of course, you say it's a family and you guys live together. It's 5 of you guys living in one house, and one person becomes infected with with COVID-19. That person needs to be isolated in the home. They need to have their own room and be isolated in the home away from everybody else. And that room needs to be well ventilated. Open the door, not the door, but open the windows in the room so that it is well ventilated within that room. And there needs to be at least maybe one person in the home that kind of goes and does everything for that person. That person, goes and does everything for the person, checks on them, maybe takes them some food, make sure that they're okay, things are okay. And that person needs to be somebody that is in fairly good health, does not have a lot of chronic illnesses, is not at high risk for contracting COVID-19. It does not need to be someone that's already maybe compromised or not in the best of health. It needs to be someone fairly healthy. And also with that person or within that home, you need to use separate utensils such as forks, spoons, and knives, eating utensils, plates, cups. All of that stuff needs to be separate. Theirs need to be washed separately. And if you can, maybe use paper plates and forks and stuff for that person. And once they're done eating, and you bring it from their room at that time while they're sick, just dispose of it. And linens, like bed linens and stuff, and clothes needs to be washed separately. It does not need to be washed all together with the other family members. Proper guidelines and practices to prevent contraction continued. Maintain at least 1 meter distance between yourself and others to reduce your risk of infection. When they cough, sneeze, or speak, maintain an even greater distance between yourself and others when indoors. The further away, the better. Make wearing a mask a normal part of being around other people. The appropriate use, storage, and cleaning of disposable masks are essential to how effective they will be. How to wear a mask. Clean your hands before you put your mask on. Clean them before you put your mask on and after you take your mask off. Make sure it covers not just your mouth and chin, but your nose, mouth, and chin. When you take the mask off, store it in a clean plastic bag, and every day either wash it, like if it's a fabric or a cloth mask, wash it. It needs to be washed daily. And if it's one of those medical or surgical like masks, then it needs to be disposed of daily, and you need to put a new one on. And don't use masks with a valve. Germs are everywhere. They can get onto your hands. They can get onto items we touch during daily activities and make us sick. Cleaning hands at times with soap and water or sanitizer that contains at least 60% alcohol is one of the most important steps you can take to avoid getting sick and spreading germs to yourself and others around you. I think the best thing to do is hand washing. Plain old soap and water is much better than just using hand sanitizer. But if you're out and about, or you're at work, or you're in a public place and there's nowhere for you to just go and wash your hands, then hand sanitizer has also been proven to be very effective. Hand washing reduces the amounts of all types of germs, pesticides, metals, and everything else like that on hands. Knowing when to clean your hands and which method to use will give you the best chance of preventing sickness. Hand sanitizer is good, but sometimes, you just got to have soap and water. I know if a person, or if you have a family member or somebody at home, say that has C. diff, and they're kind of, maybe they've been in the hospital, but now they're back home and they're being maintained at home with C. diff. And that's an infection. The person has diarrhea. Hand sanitizer is not effective. It's not effective against that. And of course, right, we know that. You know that. We know that here. It's not effective. So plain old hand washing, soap and water is most effective for that. And there's a lot of things, just hand sanitizer just ain't going to cut it. You need to just you need soap and water. You need to wash your hands. And now let's talk about how to properly, put masks and different things on, and let's go through that. So the proper way to place a mask, which I kind of spoke about it a little bit before. Sometimes when I'm out and about shopping and doing different little things, I see people, and it kind of irks me, and I want to say something, but I don't. You see them with the mask on, and these are, well, that ain't right. But I see a lot of people doing this. And I see a lot of people doing this. And I want to say so bad, this ain't effective. Like, you'll see them walking around in the stores and different stuff, and they got they got the mask like this, and I'm thinking to myself, that is not right. You need to move it. That is not effective. You've got your whole nose out. It needs to cover the nose, the mouth, and the chin. And then of course, you got this little piece of wire here that you can kind of fit it. I like to fit it down to my nose like that, so there's a good seal. But this actually is appropriate. My mouth is covered, my nose is covered, my chin is covered. I use the wire that's in the nose piece. I squeeze it. I have a good tight seal, and it's not uncomfortable. So this is the proper way to wear a mask. Not under your nose, not just covering your mouth. This is the proper way. And another thing, some places or some people, especially if you're taking care of someone at home, and even we use these at work also, these are goggles. I know they look kind of funky, but if you're one of those people that you can't really stand a lot of stuff over your head, like the shield and stuff like that, these are also very effective. You want something that covers the side, like the side of the eye, the front of the eye, and once it's closed, let's see, and then the front to keep you from any droplets or anything from getting in the eye area. These are also effective. They sell them at Lowe's, Walmart, and these are just clear plastic goggles. You can put these on, and notice if something were to splash, it's not there's a rim up here too. Nothing can come here. Nothing can come under here, and then it's closed off on this side too. So if something were to splash in my face, my eyes are still protected. So these goggles are very effective also. I wear these sometimes at work when I don't want to put all the other stuff over my head and all of that. I just, I want this protected. I wear the goggles. And another thing that we have, if you're not, concerned with, it doesn't bother you, this is a whole head and face shield. And these kind of come, I think you can buy these maybe at medical professional stores like scrub shops and stuff. I think they're selling something similar to this. I haven't seen anything like this in Walmart, but they supply these for us at work. And it's a shield, and it goes over the top of the head, and it has the band that fits on the forehead like this. And then you're also protected like that. That's a different type of, and all of this stuff kind of gets hot. That's why when we say time and duration, you gotta, if you're going in the patient's room or you're going in a family member's room at home, all of this stuff, as you can see, it's starting to fog the window up. You gotta get in and out quick. Do the care and in and out. They're hot, and then they're starting to fog up. And if you have it on too long, then you become maybe where you can't breathe. So that's my presentation. And I think I've covered pretty much everything that I can think of. And I just want to say, does anyone have any questions? Okay. Yes. Okay. Yes, I did get the vaccine. I've been vaccinated. I actually received the Pfizer. I kind of contemplated back and forth with what I was going to do. At first I said, I don't trust it. I'm not going to get it. But then I started reading up on it and just looking at the risks and stuff, because I was like, well, I work with these COVID patients and I just didn't know. But I've actually been vaccinated. I've had my first and my second dose, first and my second shot, and I took the Pfizer. I didn't have any side effects. It went very well for me. Thank you. Any other questions?
Yes. Can you still catch COVID even if you had your shot?
I believe it's been reported by the CDC, and don't quote me, but you would have to actually just go and look there. But I do believe that I saw where you can still become infected even though you've had the vaccine. I think I did read that. I'm pretty sure I did. I know I saw, and they instructed us that even though we were vaccinated, to continue to be resilient and continue to wear the mask, hand washing, hand sanitizer, and stuff like that, because I believe they said you could still become infected even though you had the vaccine. Well, this is my time, and I thank you guys for listening and having me. Thank you.